we are also engaging in this. We have put together a program for the week that starts in about 2 weeks now. Gabriel, would you like to talk a little bit about what we are doing during this week?
Oh, yes. Okay, so for the week, we are actually putting out a lot of efforts together. And if you follow us on social media, you see that we have some submissions already on social media. So before the 18th of November, I want to create some sort of online engagement, some buzz online, whereby we upload some videos, some content, graphics online. And then for the week also, we have some collaboration with our grantees. As Cecilia said, we have like 16 projects ongoing now. So we want to bring them on board so that we'll do this together. And then we'll be having a Twitter space, also known as X because of Elon Musk now. So we're having an X space. And then, of course, one of our webinars falls into that particular period. So we'll have a webinar, and then we'll have some of our grantees share their experience working on various projects because of our grant. So if you want to apply for our next grant, you want to be part of some of these engagements so that you can get to see the kind of projects to fund. And then we have a very interesting part of our project, of this particular project, which is the competition for young people. So we want people to create a Get DP and create a short 1-minute video of themselves describing their contribution to AMR as it relates to this year's team of Together Against AMR. So it's pretty simple. Once you follow us on Twitter and LinkedIn, you get the full details. You use the link to create a Get DP, upload, tag us, and then create a video, upload, tag us, and use the hashtag. And then the winner gets 300 USD as a gift for winning the competition. The second position and third position will get 100 USD as a runner-up for the competition. So it's pretty simple. Follow us on social media to really get reminders on this, because we'll keep reminding you even as the week unfolds. Thank you very much, Cecilia. We can go ahead now.
Thank you, Gabriel. I think this is exciting. We want to put light on initiatives and efforts to contribute to preventive actions. So apply for the micro grant challenge. Read the instructions from Gabriel and follow us on Twitter and X and LinkedIn, and you will find all the details. But happy hunting for the micro grant challenge. So with further ado, I think let's jump into our first session today. Yuvaraj, I'll leave to you to talk about just briefly who you are and what you've done before, and then you will give us this presentation.
Sure. Thank you, Cecilia. So myself, Dr. Yuvaraj Krishnamoorthy. So I currently work as assistant professor in ESI Medical College, Chennai. So basically in public health department. So basically, my previous works, like we've also collaborated with the state government and also conducted statewide analysis on like antimicrobial practices throughout the state. And we got some interesting findings and also shared it with the government and got some positive response about it. So if about me, like I'm also part of editorial board of many reputed journals like Archives of Public Health, BMC Public Health, and other journals. And I have about like 100 publications and few big chapters to my name. So that is briefly about me.
We're very happy to have you on board. So I will stop sharing my screen and I'll let you take over, and you can give us some insights from the work that you're doing right now.
Sure. Thank you. Yeah, is it visible?
Yep, fantastic.
So the topic that I'm going to discuss today is on assessing opportunities in the AMR field about the workshop, conferences, funding, and beyond that, what kind of opportunities that are there specific to AMR field. So these are opportunities that I will be discussing today. So mainly about the capacity building opportunities, networking opportunities, funding opportunities, and collaboration opportunities. So we'll be seeing each of this one by one. So the first one is the capacity building opportunities. So what I'm going to discuss is like there are so many workshops or their capacity building programs are there that happens like every now and then, and also like paid workshops with registration fees. So many things are happening. So what I will be telling is whatever the free courses that are available or free capacity building programs that are available and provided by some reputable organizations like World Health Organizations, CDC, ECDC, USAID, like that. So some of the free courses only I'll be telling. So that can be some workshops or courses that can be beyond this. So what I will be discussing is mainly from this organization and mainly the free courses that are available to help us develop more capacity on this particular AMR field. So the first one I will be telling is on which is offered by World Health Organization. There are two programs that are there. One is Antimicrobial Stewardship, a competency-based approach program, and another one is WHO costing and budgeting tool for national action plans on antimicrobial resistance. So both of them are available in WHO platform, the open WHO portal itself. You can see both these courses, which is available free of cost. And the target audience is almost all the medical graduates are the target audience for this particular program. And the main contents what they will be covering is in the first course, the antimicrobial stewardship course. The main content is on the core competencies of antimicrobial stewardship and how you can apply it for common clinical scenarios. So, and for the second one is mainly for a policy level people, mainly the costing and budgeting for making a national action plan for antimicrobial resistance. So these are two of the courses that is offered by WHO and free of cost for on AMR field. And this is the next one, which is offered by European Center for Disease Control, which is again on antimicrobial stewardship, a capacity-based approach. But this one targets mainly the healthcare professionals from European Union member states with either current responsibility or in future, they will have a responsibility of like who is doing a PhD and then going to work on this particular field in any European Union states for the prevention and control of hospital-acquired infection, either at a national level or at a regional level or a local level also. So all this audience targets, this course targets, and the main content of this course is on antimicrobial prescriptions, how to implement an antimicrobial policies, how to manage the surveillance data, how to set up a surveillance system, how to identify guidelines for specific conditions and formularies. And again, this is also target at both the national as well as the local level. So again, this is a course that is offered free of cost. And so even though it targets only the EU member states, it is better to get aware of this particular course also to maybe if in future anyone can also work on the particular EU states so that they can be aware on this particular AMR related topics. And the next course is offered by the USAID, United States Agency for International Development, again free course. And they are providing this course in two parts, Antimicrobial Resistance Part 1 and Part 2. And again, this targets all the medical graduates. And again, this is going to give you, the main content is going to be on core competencies of antimicrobial stewardships and how they can be applied to the common clinical scenarios that can be faced at day-to-day. And the next antimicrobial stewardship course is provided by the CDC USA, which is again a free course. And this one mainly targets the clinicians. So what it does, what is the main content is that it helps the clinicians to optimize the antibiotic usage and also to in order to combat the antibiotic resistance. And the end target is to improve the healthcare quality and patient safety. So these are the four capacity building opportunities that I'm projecting here in this particular webinar. As I already told, there are so many workshops and capacity building opportunities are there, like which happens like every now and then. But these opportunities are available, like it's always available online, so anyone can enroll, and it's of free of cost. So anyone can make use of this courses. Next is about the networking opportunities, like the conferences or any forum that is there, especially for related to AMR field. So the first one is Emerging Antimicrobials and Diagnostics in AMR, EADA, which is conducted as a part of WHO World Antibiotics Awareness Week. Every year it is conducted. So one of the main thing why I put this in this particular webinar is that it has a special networking opportunity. That is, it has a special matchmaking program which connects the startups, academic people, research people, hospitals, venture capitalists, like all the possible stakeholders who are working in the AMR field. They allocate a specific time slot. In this particular time slot, these people can interact with each other and make further collaborations, make more networking, and to identify any strategies that helps to combat antimicrobial resistance. So this is one of the main thing why I want to put this particular program in this networking opportunity, as they have a specific time slot itself for this networking opportunity. The next one is World AMR, World Antimicrobial Resistance Congress, which happens, which also happens every year, but usually it happens in USA, like it happens in Philadelphia, Pennsylvania, and Washington, DC, like that. Mostly it happens in USA only. And here also, what as a main goal is that all the stakeholders who are involved in this AMR space, they meet together, brainstorm some ideas, and formulate initiatives that can help to tackle the antimicrobial resistance. So again, this is another networking opportunity that is specific to the field of AMR. And the next one is for the early career researchers or the young professionals, that is the Global Antimicrobial Resistance Youth Summit. And you can even see the recordings of this is available in the WHO website. In the Antimicrobial Awareness Week events page, you can see the recordings of this youth summit also. And this again happens every year. So the main thing is that here this is a youth-led summit, and it aims to empower the students with respect to various regional or regional perspectives and regional needs for antimicrobial resistance. So this is actually organized by like a World Health Students Alliance. So you can see that it includes dental students, medical students, pharmaceutical students, veterinary students, like that. It represents all the industries that have that are potential stakeholders for combating this AMR resistance. So that is one of the main thing. It brings together people from various sectors who are prime players for to combating this antimicrobial resistance, and especially for the young professionals, young healthcare professionals or students who are trying to work on this particular topic. So these are networking opportunities. Again, as I'm telling, like there are so many infectious disease related conferences or networking opportunities that are there. But what I have projected is the conferences or the forum that happens exclusively for the antimicrobial resistance. And there can be some regional conferences, national conferences that can also happen, having a theme of antimicrobial resistance every now and then. So keep a tab of those things also. So whatever I have projected now are ones that happens like every year at a fixed time spot, especially for antimicrobial resistance. People, stakeholders who are coming together want to come together and make some initiatives. So apart from it, there can be many more networking opportunities might be available at a national or even international level. So next, moving on to the funding opportunities. So as you all know, like Power Foundation is also providing yearly call for proposals and gives grants, and it provides two types of grants: educational grant for spreading knowledge about preventive action against AMR, and also research grant in order to prevent antimicrobial resistance using some innovative or newer method. So usually they provide like 3 grants of each amounting to about 1 million Swedish kronas. So this is one of opportunity, and the foundation that works exclusively on the AMR field, and the people who are working on this particular field and want to make a difference by doing a huge grant, then this is one of the ideal place to apply. The next one organization is ICAS, that is International Center for Antimicrobial Resistant Solutions. Here also they call for proposal at regular intervals, but usually they call for proposal at for different regions, like for Caribbean region, Latin American region, Asian region, like that. For a specific region, they will call for proposals, and their main focus is on policy level changes. So so even for applying for this grant, they usually expect the investigator team to have a good rapport with the state or national government or ministries. So that is one like almost like a prerequisite if you want to apply for this grant, because their main focus is also on making some policy level changes. So for having policy level changes, it's important to have good interaction or good rapport with the stakeholders at a policy level. So this is another opportunity which is exclusively for antimicrobial resistance. If you want to apply for some funding, this is another ideal opportunity. So the previous two, what I told is exclusively on antimicrobial resistance, the funding is provided. So I'm going to tell two more, which is not exclusively for antimicrobial resistance, but they have also provided a huge chunk of their grants for this AMR field. So the first one is provided by the Royal Society for Tropical Medicine and Hygiene, that is RSTMH. They also have a yearly call for proposals, usually at the months of March to April. So this especially focusing on the early career researchers who are sitting in the low and low middle income countries. So they provide a grant amounting to about £5,000, and it's not specific to AMR. On various tropical medicine related topics we can apply, but most like it's all the second or third most topic which is provided high number of grants on AMR. So those who are working on AMR and wants like early career researchers, especially if they want to do some small scale project or to get a hang of how to do research on AMR, this is like an ideal field where they can apply and get started with their career on AMR. Another one is ISID BMGF Research Capacity Building Grant, which is International Society for Infectious Diseases Melinda Gates Foundation Research Capacity Building Grant. Again, this is focusing mainly on the early career researchers who are residing in low and low middle income countries. So here they call for proposals twice a year, like summer cohort, which happened at March month, and fall cohort, like the deadline has happened only recently. October 31st was the deadline. So here also they provide, they don't like, it's not exclusively for the AMR field, but whatever the most of the themes or the topics on which they want is related to AMR, like hospital infection, nosocomial infection, antimicrobial stewardship. These are the themes that they usually have and provide grants also on this particular topic. So again, here they provide for amounting to about $7,500. So again, early career researchers, especially with public health perspective, working on a public health sector and want to work on AMR field, this is again an opportunity, especially in low and low middle income countries. So again, this funding opportunity, whatever I told now, is whichever happens like in a regular intervals and international perspective. And there are so many other grants that are available, either at regional level, national level, and even state level. Like as I told during my introduction itself, like what the project we did is with the state government grant, like a state, they have called for proposal on this particular antimicrobial resistance topic. They want to identify like what is antimicrobial practices throughout the state of Tamil Nadu, like how is the practice in terms of like whether they're using right dosage, right, and whether it's for right duration, whether it's for right frequency or right interval, like that. In across all these aspects, they wanted to know how the antimicrobial practices is there and whether it's following a standard guidelines that is set by the government of India. So that was the research that they wanted. They wanted this specifically topic to be done, and we have done this particular topic and also shared our results. Like in public sector, like we found most of the times either one of the things was missing, either the right drug was not given, either the right dosage was not given, or it's not done for a right interval. So like that, there was some sort of discrepancy was happening at least one of these stages in most of the facilities which we have observed. So we also shared with the government, and they also arranged a dissemination workshop and directly to the stakeholders, directly to the respective in charges, administrative heads of the respective facilities. They were organized and they have disseminated the results. So again, that is again a good opportunity if you want to make a difference at your state level or even the national level. So targeting the grants from your own state government or national government will be more feasible, as they can have a direct interaction with the stakeholders and disseminate your research more rapidly, and you can see the changes also rapidly. So whatever I told us, like funding opportunity that is available internationally, and that is also applied, but make note of this regional or national level opportunities also. So the last one is on the collaboration opportunities, and there is an organization like a Global Health Network where they have a specific domain, Antimicrobial Resistance Research Hub, and this is a link for that. What they do is that they link the researchers around the world, and it works two ways. Like the early career researchers, they can receive mentorship or for their as supervisors for their particular fellowship or a PhD. Or if you are like mid or late career researchers, they can act as a mentors or supervisors for the early career researchers. So it can work both ways, and both type of people can get registered in this particular platform. So this is the platform. Like once you go to that link, this is how it shows. Like, are you a researcher working in AMR, and would you like to collaborate? So like that, it will be asking, and you have to give this add myself. Click add myself, and we take you to this particular Google form where you have to fill your details. Like it will going to ask your basic details, and also ask which area of specialization or research in AMR you want to collaborate with. So here you can see like almost all the topic related to AMR is there. Implementation is starting from that therapeutics, genomics, AMR stewardship, One Health, everything is there with respect to AMR. So you can click on the relevant thing, and you can start collaborating with the researchers throughout the world who are working on those similar topic. So you can either collaborate amongst the early career researchers or amongst the late or mid-career researchers like that, or you can identify your mentors, supervisors. Anything can be done using this platform. So this is one of the platform which I wanted to highlight, which has a good potential collaboration opportunities for researchers who are working on AMR around the world. So in addition to whatever I told, these are some of the links, like the AMR, the Antimicrobial Resistance Research Hub in that Global Health Network. They regularly update whatever the opportunities that we have, like funding opportunities or networking opportunities, whichever is available. They regularly update it. And also the WHO, the World Antimicrobial Awareness Week, every year they publish it, and whatever the events that has happened throughout the world, they will publish in their particular platform. So you can make note of this web page also, and go to that and see what kind of, I can even, as I told, for the Global AMR Summit, the recordings can be found here. So like that, you can make use of this things and identify what is happening with respect to the AMR field, and make yourself get updated or identify new opportunities. Thank you.
Thank you very much. Thank you very much for that. That was really insightful. At least we can actually, just bookmark some of these links and then apply for these opportunities. But we have some questions. Because we have some people that are into research, there's a question on, do you have any scientific conference that are peculiar to AMR, or any conference that you are aware of that people can present their abstracts and probably get their travel bursary to even attend some of these conferences because of the work they do in AMR? Do you know anyone?
Not specific to AMR, but so many infectious disease related conferences. Like even now, like April, there is European clinical microbiology infectious disease conferences there, like ECCMID. You can check the 2024. It's happening in Barcelona, and they also have a travel bursaries for that. And it's for all the infectious diseases, including the AMR. So that can be a good opportunity, which they have a travel bursary. Especially, they have something called outreach grant for low and low middle income researchers. So I think the deadline is still there. Like the deadline is, I think, November 29 or 30th is the deadline. So you can make use of that. And there are something like, as I told, like infectious disease related conferences and workshops that are there, and they conduct along with this AMR theme also. So I don't know specific to AMR related conferences which has a travel bursary, but these kind of infectious disease related thing which also have a prime importance for AMR, which has a travel bursary. The classical example is ECCMID, which maybe you can note of, and maybe you can even apply also if you have some good papers for that.
All right, thank you very much. And the last question that we have is, okay, can you give us like maybe like 3 or 4 tips that you think are very important in getting funding? Just like 3 or 4 important key points that are very important to get funding opportunities for these projects.
Based on my experience, for some of these grants, I've been an assessor for grants. So even they when we were assessor, they provided a set of guidelines also. These are the things you should see before deciding whether we can give the grant or not. So some of the most important points which most of the funding agency has requested is what kind of impact or implication this is going to have in the real practice. It's not only that I'm going to do a research and publish it in a journal. That's all. It's not going to be, it's not the ending point. Like what kind of change, like a system level change, or what kind of public change or a clinical change in the clinical practice it's going to bring from your project. Even though if it's like a small scale project, which can be done even with like $5,000, like a early career researcher grant, what kind of even the local level changes that can happen, and how you are going to ensure that that's going to happen. Like if you can make, that is one of the main thing. There are so many other things, like methods part is one of the it should be robust. All those things already people know, like methods should be robust, and how proposal should be written. All those things people already know how it should be written. But mainly the funding agency, what they want to see is that what kind of change the if once I give this particular grant to this particular person, what kind of change is going to bring out of this particular grant. So that is one of the main thing. And you have to convince, like telling, especially you can even divide and tell that what kind of academic impact your proposal is going to have, what kind of health system impact your proposal is going to have, what kind of societal impact your proposal is going to have. Like that, you can even stratify and tell them, so that they can also understand, okay, this is how, if I give this proposal to him or her, this what is going to happen. So you have to make that particular tips maybe I want to give in this particular thing.
Thank you so much. And I can just echo that being able to track impact is really important. So when you can show that the work is making a difference, I think that is one of the key things to look for, at least for us. Well, thank you so much. That's insightful. Gave us a lot of tips on how to expand and find resources to work on this important topic.
Thank you. Thank you.
I will then introduce Getachew. Welcome to the session. You will talk about the work that you're doing, but can you start by telling us a little bit about yourself?
Thank you so much, Cecilia. My name is Getachew, and I have a background in the academic area. I have been working at Welaga University and Addis Ababa University. Then for 1 year, I also joined the USA Medicines and Technologies and Pharmaceutical Services program, which is now closing. And now I'm working at Addis Ababa University in the Department of Clinical Pharmacy and Pharmacology. So I do have a background on antimicrobial resistance since from my master's thesis, and mainly engaging deep into the area since September 2019. This is,
Very good. We're excited to have you here, and I will stop sharing my screen and you can start sharing yours, and then guide us through your presentation today.
Thank you so much.
Fantastic.
Can you see my screen?
It looks really good. It looks good. You're good.
Okay. So here is the title of my presentation. When reserve exceeds access, it started with a case study of Cefazolin in Ethiopia. Here, the conflict of interest I want to declare. Some of the works were granted from various sources that I will speak on some specific topics under each. Here is the outline. Why Cefazolin as a case study, global Cefazolin shortage and disparities and inequities in antibiotic access, and finally the strategies to address those shortages. So here with the session objective, I'll jump to my supposition. A very important point is that shortage of essential antibiotic is a major driver of irrational antibiotic use. Particularly, this is true in developing world where there is a lot of shortage in the antimicrobial area, and very important, this may have a different context from other, particularly high-income country contexts, and different driving factors, and hence may require different mitigation strategies than the developed country. So this is a very important note. Actually, it's not unique, different, but it needs to be seen in this direction. So to start with Cefazolin, Cefazolin, as you know, is a semi-synthetic first-generation cephalosporin. It covers gram-positive as well as some gram-negative microorganisms. Among the gram-negative, it's active against E. coli, Klebsiella, and as well some protist species. And this drug is indicated for various clinical infectious cases, like it's mainly indicated for surgical antibiotic prophylaxis. It can also be used for skin and soft tissue infections and other infections. Very important aspect of it is that it's relatively safest and good to administer than the anti-staphylococcal penicillin class drugs like cloxacillin, oxacillin, nafcillin class drugs. And this drug is classified as the essential medicine in the WHO as well as the Ethiopian essential medicine list. One of my earliest work on this area is that in 2017 at Naqamte Referral Hospital, published at PLOS ONE, well, one of the finding is that the drug choice for surgical prophylaxis is less compliant, about less than 10% of the cases as compared to the guideline recommendation. One of the major challenge in that area is the absence of first-line drugs in the pharmacies as well as in the local supply hub. Another work we published at PLOS Global Public Health is a continuation of it, and we assessed the shortage of Cefazolin in the Ethiopian pharmaceutical supply system as well as other local pharmaceutical firms. And we found Cefazolin is not available in the market. The drug product list of those companies do not have Cefazolin in their list. And very interesting, the drug is included as a first-line drug or as an alternative in the standard treatment guidelines as well as the essential medicine lists. But when we see in the procurement list of the government supplier, it was part of the procurement list in the previous version, but it on the 2019 revision. Another important point that we did is we try to contemplate why this happened, and we try to focus whether there's a demand for the drug or not at the hospital level, so that we carried out a qualitative study, which is an ethnographic study at Kurambasa Hospital. And what we found is that the demand for the drug is very minimal, and the practice by itself is something delegated and custom guided type. So based on that, what we suggested is that the surgical antibiotic use requires optimization, or antimicrobial stewardship may be one of the important options for that case. This work is under review in the Frontiers Public Health Journal. Another important work that in progress is a quality improvement initiative. As I told you, I joined the USAID TAPS program for the last 1 year, and there we are able to run a quality improvement program based on the background I have in collaboration with particularly the ministry is the leader of this program actually, and the USAID is collaborating on the area. So what we did is we carried out a baseline assessment in the area across the country, particularly in 5 hospitals, and we scaled up it to other 3 hospitals. And what we found is that the choice, the dosing, the timing, and duration of surgical antibiotic prophylaxis, which are abbreviated as SAP, is very minimal from the baseline, although there is a variation from facility to facility. So based on that, we planned an intervention, which is ongoing, particularly focusing on education and supervision, as well as non-regular audit and feedbacks. So the main the important point is that it's well accepted, but there was changes in the choice, the dosing, the timing, and the minimal changes on the duration. But it was fascinating that the drug shortage still persists, and it's one of the greatest challenge for the success of this program. The only 2 facilities among the 8 facilities did have Cefazolin, or does have Cefazolin, but it's also stocked out in BT1. So this work is now under in press in Journal of Infection and Public Health. We're going to publish it recently. Generally, there are experiences of Cefazolin shortage across the globe. In the US in 1999 and August 2000, India in 2060 due to the drug and price control order of the government, in Japan in 2090 due to the manufacturer-related issues, in Ethiopia. The exact date when it started is not known, but we assessed the market that there's a shortage since 2080 and to the present time, and primarily this is due to dysfunctional supply. One controversial point regarding published works in the area is that stockout and shortage are used interchangeably, but that is something different. And our focus is on the shortage where the drug demand is higher than the supply of the drug, which necessarily not mean stockouts. When we go to the consequences and the damages of drug shortage, as an example of Cefazolin shortage, one of the major issue happening is there was a shift to the watch and sometimes to the reserve category of drugs. One of the main occurrences across the globe is an increased use of third generation cephalosporins, as you see in this graph in Japan. Another is treatment failure, probably, for instance, in the case of Cefazolin. Cefazolin may be superior than vancomycin for methicillin-sensitive Staphylococcus aureus. So there will be a treatment failure if the vancomycin used in place of Cefazolin. Another may be adverse effects associated with alternative drug use, and another may be as reported in a Japan's study secondary to Cefazolin shortage. There is an increased rate of reoperation after surgery with other drugs than Cefazolin. Another very important point may be that, yes, it's true that there will be a disturbance of the supply system due to shortage of drugs, and even this may be an opportunity for introduction of falsified medicines. In the literature, there's a very limited data in the low and middle income countries like Ethiopia on the drug shortage. Globally, what we found is that this is one of the well articulated research by Braun and his colleagues. And what they found is that there's a disparity and inequity in antibiotic access. They analyzed about 209 studies, mainly focusing on consumption and antibiotic use. And they found that there's a disparity in antibiotic consumption. For high-income countries, it's about 20.6 defined daily doses versus low-income countries 13.1. This about it deviates by about half. So there is a substantial variation in antibiotic usage between and within countries, and there is a consistent low access or usage of antibiotics, particularly in the sub-Saharan Africa region. From the region, within the region, there is also variations. As you see, in the yellow shaded areas, the antibiotic use is below to 30%. Particularly Ethiopia is under this area, and it's about 28% for Ethiopia specifically, and higher for Sudan and some other countries around in the sub-Saharan Africa region. Another study published is the antimicrobial consumption surveillance report of 2007 to 2090 by the Ethiopian government. What they found out is that there is a persistent decrease in the consumption of access, watch, and reserve antibiotics. You can see the access antibiotic consumption decreased from 28.99 to 3, which is an extremely extraordinarily high decline, and it was remained the same on 2019. Before this presentation, I carried out some quick online survey about the shortage of essential antimicrobials available in the latest version of the Ethiopian medicine list, and 22 individuals responded. Those are pharmacists and physicians. And what we found, as you see, there's a shortage of multiple antimicrobial drugs. This is very fascinating. You can see amikacin, cefazolin, and multiple other drugs are in short supply. And among antifungals, you can see the amphotericin B, traconazole, some other antifungals are in short supply according to this response. There are various reasons of shortage. Shafik et al. Reported or categorized those reasons into three, related with the supply system, related with the pricing system, and also related with the regulatory system. So this is one of the interesting study in the area and a relevant point. Based on our survey that I told you earlier, the reasons identified were inadequate or poor supply planning and attention by the government, and problems with the import are the major reasons for the short supply of the essential medicines. We also asked them to respond about the prolonged shortage of the drugs, and they listed out multiple drugs as they were totally absent from the market for about a year or like that. And some of the reasons they suggested were procurement and supply is not guided by the EML is one of the major reasons they suggested, and other reasons are there. Very important of the low-income country landscape is that there is a chronic or endemic shortage of essential antimicrobials, which I think is resulting in a chronic deformation in the healthcare infrastructure. However, the problem and its extent as well as its consequences is not well addressed. Strategies for addressing this issue again by Shafik et al., who suggested a consortium approach, and here are the 4 dimensions of addressing this, including political commitment, economic viable options, and partnership approach, as well as strengthening the supply chain system. There's another global initiative to address shortage of antimicrobials, which is known as SECURE. This SECURE is an initiative by WHO and GARD-P, and it's mainly focused on accessing some reserve and new antibiotics, but also they work in a limited capacity on generic antibiotics, which are persistently in short supply. Finally, strategies to address antimicrobial shortage, focusing on low-income perspective. This is my proposal actually. Establishing a regional and national task force is one of the suggestions by multiple published works, including the World Health Organization publications. National studies on the extent and type of shortage, as well as reasons and mitigation strategies will help, where this is particularly true for low-income countries where the problem is not well understood, or there are poor reporting on surveillance systems. Winning political commitment is also stated. Strengthening the supply system, focusing on the procurement, the planning aspect of this, and focusing on the national policies and something like that will help. So with this, I can conclude my presentation. There is a huge disparity in antibiotic access in LMICs, especially the sub-Saharan Africa region. There is a consistent shortage of essential drugs due to various reasons. Actions that are required to address this shortage should be at the forefront, particularly in the perspective of addressing antimicrobial resistance and managing wastage of these precious drugs. However, there is usually an urgency dilemma, and there is a little commitment in the area. So therefore, a comprehensive plan, international cooperation are extremely relevant for addressing these issues. Particularly regional initiatives for the Saharan Africa region is highly required. So I would like to say thank you. This is all on my side. Thank you so much.
Thank you, Getachew. I think you've done a good and comprehensive in a situation analysis in Ethiopia and also in general. When you presented this and you got the results, have you seen any reactions from your government or in Ethiopia?
Yes, we have discussions with the government regarding Cefazolin shortage, the supply chain. There's a supply chain department in the government that continuously talk with the Ethiopian pharmaceutical supply system. We insisted them to address the issue of Cefazolin at least, and what we get promises that they are planning to include in their pharmaceutical procurement list. That's one of the very important point. Actually, the list is that we speak with them at the final stage of the list revision, but they agreed to include at the footnote at least.
Understood. Gabriel, any other questions from the audience?
Yeah, I just want to ask about other like civil societies, organizations apart from USAID. Are you getting some support and interest from other organizations apart from governments, apart from USAID that is kind of supporting this project?
Would you please repeat that? Other supports?
Yeah, are you getting some sort of interest and support from civil societies, like non-governmental organizations, student bodies interested in championing change in this particular area? Like, what sort of other support are you getting locally, apart from government and the USAID?
Probably I may have a limited understanding of that area because I'm primarily working on the service delivery dimension, and the supply chain is another separate department. So I do have an interaction related with Cefazolin, limited to Cefazolin, and the MTAPS program is working on that specific area, and I have been part of that team, and we communicated for that specific reason. But my personal experiences are based on the available evidence in the web and something available in colleague communication, and I am not sure of that. Thank you so much.
All right, thank you very much. Thank you.
Fantastic. Thank you again. Interesting to hear about the analysis that are done, and it's true that there are so many things needed, and if we join forces, I believe that we can take a lot of action to prevent antibiotic resistance too, not only just the scarcity of medicine, but also helping understanding how to prevent antibiotic resistance in the first place. With that, thank you for sharing insights today. The next session we have is during the World Antimicrobial Awareness Week on November 22nd. We have 3 speakers joining us, 10 o'clock in the morning, similar to this hour, so 10 a.m. Central European time. You can register on the link that you see in the window, or you find the link on our social medias when we're getting a little bit closer. But with that, I'd like to thank everyone who joined today. You can always reach out to me and Gabriel if you have questions or thoughts, or if you have ideas of what you would like to hear in seminars and webinars that we host moving forward. I wish you a great day, and thanks for joining today.
Thank you so much, Cecilia and team Gabriel. Thank you so much.
Thank you.
Thank you. We have a question that just came in now.
Yeah, Getachew, if you are still around, there's a question for you here.
Getachew, are you still around? I think he left already.
Okay, then let's bring this question to him.
Yeah, via email. And then we'll also respond via email.
Thank you.